Hi, my name is Jasmine Vargas. I'll be sharing my understanding of health disparities and how they affect communities, including my own, and what I believe can be done to reduce them. As a first-generation immigrant child of Hispanic immigrants, I have been gifted a different perspective on health disparities. Health disparities are differences in health outcomes and access to care that are closely linked to social, economic, and environmental disadvantages. These disparities often marginalize racial and ethnic groups, as well as people with lower income and educational levels. Education has a huge influence on health. People with higher education levels are more likely to understand health information, make informed decisions, and access better jobs with health insurance. In contrast, people with less education may struggle to navigate the healthcare system or afford preventative care. In an article published by KFF called Language Barriers in Healthcare, they stated that around 26 million people within the United States have limited English proficiency, also known as LEP. Hispanic people account for 62% of the LEP population, while over 22% are Asian. I have had firsthand experience working as a medical assistant on how language barriers and lack of health literacy can make it harder for older individuals who English is not their first language because of the lack of translated medical information. Furthermore, race and income still play a major role in determining who gets quality health care. For example, a research from the Kaiser Family Foundation shows that people of color often experience a higher rate of chronic disease, like diabetes and hypertension, partly because of unequal access to care and differences in social conditions. In some Hispanic communities, health issues like mental health or cancer screenings are under-discussed due to stigma or lack of promoted information. Cancer is the second leading cause of death among Hispanic people, accounting for 17% of deaths, and are more likely to develop cancers in liver, stomach, and cervical, which are linked with infectious agents such as HPV and are largely preventable with screening, stated by the American Cancer Society. When communities face these disparities, it becomes harder to promote preventative health measures. If people don't trust the healthcare system or can't afford regular checkups, they're less likely to get screened early or vaccinated. This leads to worse outcomes over time. Addressing these gaps means making health education and resources more inclusive and accessible. I believe these disparities weaken the healthcare system overall. When there are groups of the community that are underrepresented or lack support, the system becomes reactive rather than proactive, treating illnesses instead of preventing them. This not only increases healthcare costs but also deepens inequality and mistrust. In my community, increasing language-accessible healthcare and education and cultural-sensitive outreach can make a big difference. Partnership between healthcare providers and community organizations can help bridge gaps in trust and understanding. For example, one way healthcare providers can increase health education is by providing health pamphlets and clinics in different languages. This small change could create a gigantic difference in quality of health for individuals that are not fluent in English. Healthcare professionals have a responsibility to advocate for equity. This can be done by recognizing biases, improving communication with diverse patients, promoting policies that support fair access to care. It is the responsibility of all healthcare professionals to stand up for a change to create a better future for patients. As a Hispanic woman who is interested in creating a change in the healthcare industry, my goal is to help people feel safe and better. This course has shown me the importance of being self-aware and empathetic, which will help me connect with patients from all backgrounds and work towards a more equitable healthcare system. I have learned that the impact of different conditions on the quality of life and how having a good supportive provider can create a significant difference in an individual's life. Again, thank you for listening to my video, and I hope you found these topics as interesting as I did.